Hello, I'm Dr. David Hornbook, the Clinical Director of Education and Technology here at Keating Dental Arts in Irvine, California. We're here today for another one of our weekly podcasts under Dental Up. You know, we're here with Steve. Thanks for being here, Steve.
Nice. Good to be
Steve is the implant specialist here at Keating, and I spent some time to interview you about 2 months ago,
Yes.
early on in our podcast.
Right.
And for what I thought was originally going to be kind of a boring subject, it was very cool and fun to talk about,
was
you
very
know, the things that you encounter
Right.
and the problems doctors have as they're sending implants. And, you know, and so I've been here now at Keating for 8 months, and as I walk around the different departments, you know, you're the ones with, your department is one with all the cases on carts that the doctors need called back.
Right.
And, you know, sometimes it's, whether the implant not be placed in the right spot, you're not sure what kind of implant it is, you're not sure if it's seated right, question about restorative, and there's so many options now.
Right.
So this is going to be a little bit of review for people that have listened to this before, but I'd like for you to talk a little bit about the common problems. We saw some cases on the floor today. Some of the common problems that clinicians are facing with the implants that they send.
A lot of the times it's we have orientation issues when the doctor's taking the transfer assembly and they don't take a bite wing or a radiograph to verify this, you know, the seat in that, and that's one of the main problems that we have is the orientation being off. Another thing is that we get a lot of problems with the bite registration not be taken, whether they use a open tray or closed tray technique. If they use the closed tray technique, use a triple tray, which a triple tray we kind of want to lean against, because it defeats the purpose of having the transfer assembly and then biting into it to get occlusion. It's a little taller than the adjacent teeth, so that kind of defeats the purpose. So we like to get a full arch, you know, impression with the transfer assembly, and like we talked about before, is blocking out the screw hole, so it's not into the impression. But of course I'm assembling a lot of them under the scope now to make sure we have a definitive seat, and then if I see anything different or weird, we always call and touch base with the clinician and let them know, doctor, this is an area that we may be, you know, something we want of concern. You know, so we do.
You know, I'm going to put you on the spot here a little bit, and you can plead the fifth if you need to.
That's
There's, you know, because you know, if I had this conversations, we're looking at the cases where you'll say, oh, this implant, I hate working with this particular implant, or you can't get parts, or the implants aren't as good, where I love working with this. So if you had to tell me, you know, if I called you and say, hey, I've got this very cool case coming up, I haven't ordered the implant placement yet from the surgeon, and it's a molar, a posterior tooth, what implant system should I tell the surgeon to use? Or what would be some of your top choices?
a recommendation of what systems. I mean, we have, of course, we do all the systems here, and if we can't find them, I'll track them down. Our number 1, 2, and 3, let's say, would probably be Nobel. Is one of the top 3. Zimmer also is another one that is very common. We do have our BioHorizons, you know, which are also very common. But those are probably the 3, and then of course Straumann and 3i. That's the top handful that we really do the majority of restorative on.
Are there some, so, you know, the one thing that I think a lot of general dentists that are listening or watching, they send the case to the oral surgeon or the periodontist, and they don't specify an implant type. And I had that problem. I ended up getting an implant, not part of the original treatment plan, and I wanted to do a hybrid abutment, and it turned out this particular implant company didn't make that type of abutment, which screwed my whole treatment plan because I'd already told the patient this is what we're going to do, assuming. And so limitations as far as, well, let's talk about the best. As far as, you know, you get an implant case from a dentist, knowing that more than likely this implant company is going to have probably whatever you need, whether it be a hybrid, whether it be a Thai base, zirconia, metal, gold adapting, kind of the same order?
It's kind of the same order. I mean, I did forgot to, you know, of course, Atlantis, I mean, not Atlantis, but Dentsply with the Astros. That's another big one also. Usually what we start to run into troubles is on the narrower fixtures, these 3.0s that are coming out, because they're so narrow that you can't really even, let's say what would be a Noble Pacero abutment or an Atlantis abutment, they don't even have those platforms for those, are milled out yet for that. I'm sure they're coming out with it, but it's kind of where it's catch-22. It's like, well, we can do it, but I need to go this route because I can get a tie insert, but maybe like I just ran into where Astra did not have the 3.0, but I found a company that did make it.
Okay.
So, and that's the crown that I showed you earlier
Right.
today, and that was the hybrid screw retained.
Right.
You know,
Yeah, and it looked awesome.
it looked
What a
nice.
great
but
option. Too.
I kind of, let's say, did some little engineering, a little process on it, and I was like, okay, you know, I can make this work. I called the doctor and I said, Doc, we can't. This isn't going to be an Astra abutment, but I can find one that will work in the situation.
Right.
He was okay with it,
Yeah.
as long as we're upfront and let the communication between the dental lab and the doctor. And things usually work out fine. But
Yeah,
there's
and I think
specific-
that's a huge benefit of a doctor working with Keating or with you is, we do so many implants that, I mean, I've seen your catalog. It's almost like going to the auto parts store and they've got
It is.
all these catalogs
Yeah,
of different screws and bolts and batteries and,
Yeah,
and clutches and
it's funny, I had my miscellaneous drawer, which just had some off brands became less and less because these are becoming more mainstream and mainstream. I mean, there's Portugal's got one, Neodent, and Straumann actually bought a portion of them. So there's these companies are coming out that you really have to stay on top of it.
So let's go the other route. Is there any particular brands or manufacturers of implants that you don't really like to work with? Meaning it's difficult to find parts, parts maybe don't fit quite as good as you would like, or limited restorative
There's
options?
like that one company I just mentioned, Neodent is kind of a new one out there. There's some that, you have your online implant companies like the Blue Sky, which is an online, which is hard to. They have the array of parts. You just have to go online to order it, where there's no communication. Well, let's say with calling it. I mean, they have a technical support team, but it's just I like to talk to